Okay, well, I just want to have a big welcome to all the alumni from all around the country, and I'm sure some of you are from around the world. I want to thank you for coming to this wonderful annual event. My name is Mickey. My name is Mickey Aramati, and I'm a former president of the Alumni Board of School of Public Health, and I'm currently serving as the a member of the Boston University Alumni Council in the Charles River campus. I hope everyone is enjoying APHA conference, and I hope you're enjoying New Orleans. I'm trying to learn some few words, like I think laisser the temps rouler, and I speak French, so, and I still can't figure it out. But it's great to see many familiar faces and old alumni from here, from the School of Public Health, and former people who have also received this great award. And we have graduating, we have people who graduated here from the 80s. 80s, anybody? Yay. It was a good 80s, but, and we also have all the new current students are here too. Yay for the current students, yay. We still love you. Okay. Anyway, it's an honor for me to introduce Dean Robert Meenan. Dean Meenan is the longest serving dean of the 16 schools and colleges at Boston University, and he has 22 years of leadership, and he still looks good wherever he is. He has survived the 22 years, but he has worked really well with us on the alumni board and the alumni and for the students. And anyway, we really appreciate all his leadership for 22 years. He himself is a double terrier. I have to read this because he has a long bio and I can't do it all, and I'm supposed to be concise. So sorry, Bob, if I miss some. He graduated from the medical school and the graduate school of management, and both of his children also went to BU. He has been on the faculty of BU since 1977, and prior to becoming Dean of the School of Public Health, he served as arthritis section head and director of NIH-funded multipurpose arthritis center in the School of Medicine. And I only had one drink, so that's good. Dean Meenan has an accomplished career, and it was announced last fall that he will be stepping down as dean. He will assume a special projects position reporting to President Brown, taking on university-wide initiatives. Don't forget us, Bob. And we know, as we know, BU's School of Public Health has grown tremendously under his guidance and leadership, increased the number of enrollment. He expanded the research support and the rise in the rankings. And also, as you can see, a huge amount of alumni. We keep growing every year, which is terrific. And we have these wonderful events, and we have all these great people who have received awards. And I try to do a trivia question, but they told me I have to keep concise. But I'm trying to figure out how many people did he actually give awards to for his 22 years, and how long, how many. But anyway, I'm gonna skip that. My fellow alumni and friends, please meet, actually, Dean Meenan.
Thank you, Mickey. I told Mickey she had to improve her introduction. The reason is she would usually come up and introduce me as the best dean in the history of the School of Public Health. And I pointed out there were only 2 deans in the history of the School of Public Health, so I'm glad she upped her game a little bit. I can't resist also adding that I went to BU, as Mickey said. Both my kids graduated from BU, and my lovely wife, Yana, who is here, just received her MSW recently from BU. So we're like a real dual degree family now. So it's really great to be here in New Orleans. And Mickey, the only words you have to know about New Orleans is you have to be able to say, laissez les bon temps rouler. That'll work, okay? All right. So as Mickey said, the school has done very well, and you know I recognize that It's partly due to my efforts, but it's been due to the efforts of so many other people. Our staff, our faculty, our alums have all pitched in and done remarkable things over the past couple of decades to make the school expand. And I think back to when I started, we were in the A building, and a few of us are in the old Talbot building before it was condemned. And to see, some of you remember that. And to see now the Talbot building has become the iconic building at Boston University. It's the School of Public Health's home. We have another, half the school is in the Crosstown Center just down the street. We have wonderful space, and it's been a real change in the school over those years. Some of you may remember the size of the school. It's a lot bigger than you remember. We have about 1,000 students now. We've increased our MPH classes on a regular basis, and it really is a wonderful thing to see how the school has done. The research program has enlarged steadily, and we're now doing about $40 million a year in research, and we have an operating budget of about $80 million, which is, again, very, very different than it was when some of you were there. As I look at a few of my notes here, that we now have 48 countries represented in our current student enrollment. We've greatly increased our career services office, which has worked very closely with the alumni. And as I've often said, the alumni help the school in a variety of ways. You give time, you give money, but you also help us tremendously with connecting our students with practicum and employment opportunities. So thank you for that, and we appreciate it and hope you will keep it up. As I said, I often take the opportunity to embarrass people, so I'm going to do it again here. And one of the things I just want to call attention to, some of you may know that on Thursday, I believe, it was announced that Mark Prashker, who's the Associate Dean for Development and Planning at the School of Public Health, announced that he is stepping down. Mark will be stepping down in June. He'll be spending the first 6 months of 2015 working closely with the new dean, advising him and helping him get positioned. And then Mark is going to go on to other things in life after spending about 2 decades almost at the School of Public Health. So would you please join me in a round of applause for Mark and all that he's done. And those of you who know Mark would recognize that what he really really appreciate is not just congratulations, but for those of you who can do it, if you don't have other strong affiliations, he would like you to all cheer for a Steelers victory on Monday Night Football tonight. Tried my best, Mark, what can I say? Okay, so one of the best reasons for this event every year has been the awarding of Distinguished Alumni Awards. And I'm pleased to say that this is actually I think now the 15th year we've done it, if my math is correct. Let's see, 25th. So since, at my age, 10 years here, there, it doesn't matter. So it's the 25th because we've been doing it since 1989. And so we are pleased to recognize our alums who have made outstanding contributions and exemplify dedication to the field of public health on local, national, and global levels. So we have 3 award winners tonight. We have some interesting connections and some interesting differences. We actually have 2 members from the same class, the class of '97, so that's a nice connection. We have one person who's traveled about 3 blocks to be here from her office. We have another who has traveled from Tokyo to be with us tonight, and then somebody who's based right around the corner from us in Boston. So without further ado, let me begin the introduction of our award winners. So our first award winner is Ikushi Onozaki, MPH class of '97. Dr. Onozaki, would you? So in part of your appreciation for him, I should mention that not only is he deserving of an award for his accomplishments, but he's also deserving of an award for his dedication to being here tonight. Dr. Onozaki's son was married yesterday in Tokyo. And he realized, as a Jules Verne fan, that he could actually get here tonight because of the international date line. So I have no idea what time his body is telling him that it is, but it's wonderful that he could be here. So Dr. Onozaki is an infectious disease physician, also specialized in respiratory medicine, and he's been leading a prevalence survey group of the WHO Global Task Force on TB impact measurement for 7 years. Since he began TB prevalence surveys, many countries in Asia and Africa have utilized those surveys to clarify and monitor each nation's TB statistics and status. He has contributed to a number of WHO policy papers and guidelines, and he's mentored a number of young professionals in various countries to implement epidemiologic studies and operational research. A native of Japan, Dr. Onozaki was the director of the Department of International Cooperation at the Research Institute of Tuberculosis in Japan, and he has held positions as an advisor, technical expert, and medical director at a number of organizations. In addition to his degree from the School of Public Health, his MPH, he's also a graduate of the School of Medicine at Chiba University in Japan. Dr. Onozaki, thank you for being here and congratulations on your accomplishments, and we're pleased to give you our Distinguished Alum Award. So let me see if there's a... Okay, I think we're going to do it later then. I'll leave it right here for you. Would you like to make
Thank you, Bob, and the distinguished professors and my colleagues. So it's really my pleasure to be here. So just after 1 day of my son's wedding reception, actually I didn't imagine that, and I can be here. But owing to international deadline, then as Bob mentioned, then I'm here. Actually, then 4 days before, then I flew from Geneva to Tokyo and teach 1 day in my home school, mother school in Chiba, then attending my son's ceremony, then being here today. So actually, because I have honor here, then the reason is by tuberculosis, I want to mention about TB situation here. So, you know, then around 9 million people are getting TB, so every year. That's huge. And including those with HIV, so more than 2 million people are dying with TB still. So that's also then huge, so victims. Actually, but in 2005, then global target was there, that 90% case detection and 85% cure. At that time, globally, we celebrated. Yes, we got it. We achieved the target. Then we expected the decline of case detection. Because once we detect enough cases and enough cure, we should observe the decline. But we couldn't. The most high-burden country didn't see any decline of TB disease. That's why we start to count the number of the cases in the community. 2007, I joined WHO. Then I start to count the cases in the community, visiting the villages with a power generator and X-ray machine portable, and take X-ray 500, 700 in 1 week. Then if any shadow, then take sputum, bring back the sputum to the center. Then we realize that TB burden is higher. So now nobody believed that 70% are detected in 2005, sorry. So now 9 million cases, and WHO says 3 million missing. So 3 million per 9 million is exceeded 30%, right? So nobody believed that. But real problem is much bigger, we found that. So 50 years, there are no such kind of survey in African countries, but Ethiopia, first country finished. Now nearly 10 countries completed. And in ASEAN countries are huge. In Indonesia, we found that 1% of the adult male has bacteriological positive pulmonary TB. Now, actually, we changed the TB epidemiology globally. That's why this year, for the first time after global report published, the number of the TB patients, WHO have upward revision. Again, 9 million. One time dropped to 8 million, but again, 9 million. So we are doing this study for the sake of the very voiceless or silent patients. If we don't estimate, or we don't know the real number of the cases, we can't provide treatment. That's why then we do study this, and so then we convince the WHO, the bosses, that no, we should revise the burden and upward for the sake of the patients. So I'm very proud of that. Then we continue then these kind of the work then to have for the sake of the patient, for the sake of the people. And second, I'd like to mention Cambodia because before joining the work in WHO, then my first major work after graduation of BU was in Cambodia. So actually, BU should be proud of that. Not my work. Actually, around 96 to 98, BU received many Cambodian young doctors. After Pol Pot, lots of doctors are killed, but BU received many Cambodian young doctors, and they are real asset. Actually, my work in Cambodia to rehabilitate TB program and health sector actually is really owing to their effort. My counterpart graduate from BU, 5, 6 doctors, they are still continuing work in the government. So actually, those people who are not only in Cambodia, but also globally, or countries, there are so many now graduates working in the country, their own country, to make their effort to develop their country and make country better, and to make people happier. That's a real asset of the BU, actually. So I appreciate this, my honor, to receive this on behalf of all Asian, because I found that only a few Asian people receive this. So, that's why I want to introduce their efforts. Then we really have those colleagues who are working their own country to make their efforts. That we really need to recognize. So I'm very happy to receive this award and to represent all those, my colleagues in the country. Thank you very much.
I will keep this up here, okay, for you later. Thank you. Thank you, Dr. Onozaki. It's a reminder of another transformation at the School of Public Health. When I started, we were very much a Boston-focused school, local school, both in our student body and in our reach. And then we developed an international health department, which is now a global health department, and a Center for Global Health Research. And it's just wonderful to hear the impact that we've had on TB as a disease and on Cambodia as a country. It's very nice. Our second award goes to the person who's traveled the shortest distance, Amy Zapata. Amy, come on up. I think some of Amy's colleagues may be here. Amy is currently working here in New Orleans for the Department of Health. She directs the MCH department at the Louisiana Department of Health and Hospitals, and her office is about 5 blocks away, ballpark? Yeah, okay. Mark Prashker and I had the opportunity to go meet with Amy the other day, and we learned some interesting things. I thought I'd find a good Southern girl down here working for the Louisiana Department of Public Health. It turns out she's actually from Wayland. And I learned she's an expert on all the ice cream parlors in the Wayland and Carlisle areas. So I also realized that according to her staff, she is actually secretly a Jedi Knight, which I'm still trying to figure out whether she learned that at the School of Public Health or if she had an innate ability. It was Merrigan's class, okay, all right. And then perhaps most importantly, she's a mother of a 9-year-old son? 9 and 11, okay. She was telling us that her second son was delivered just around Katrina, and she described it as not a normal delivery. And I don't think she was talking about the biology. So, Amy, it's great that you could be here to accept an award as our distinguished alum. And let me just tell you a bit about what Amy has done. And she asked me to be brief, and I think I'll be as brief as Mickey was. So Amy manages the state's MCH Title V Award and the Family Planning Title X program for the Louisiana Department of Health and Hospitals. She oversees and directs supportive services, health education and communication, training and policy development in those areas. She serves as an appointed member of Governor Bobby Jindal's Early Childhood Advisory Council, along with performing behavioral health planning and domestic violence commissions. Prior to her current role, Amy was the surveillance program manager for the HIV/AIDS program at the Department of Public Health, where she managed the department's responsibilities for statewide HIV monitoring, including case and data management. She worked on special projects in local and national work groups to develop surveillance policies and protocols, and has clearly had a wonderful positive impact on first the HIV programs and now the MCH programs at Louisiana Department of Health. And as Mark and I learned after talking to her, I have no doubt that Amy is on the track for more responsibilities and even greater impact. In addition to her BU MPH, she's also a graduate of Mount Holyoke. So somehow we found out actually why it was. It was a guy. She was at Mount Holyoke from Wayland, and then BU School of Public Health, and then Dr. Zapata met her, and they came down to New Orleans and have done great things here. So Amy, congratulations on all your work down here in Louisiana, and we look forward to even greater things.
With my noisy contingent. Well, thank you very much. I know you were a little disappointed that it was actually my Mount Holyoke credentials that got me the wave into a job in the Office of Public Health, but it has definitely been Boston University that has also served me very well. So welcome to New Orleans. It's not usually quite this chilly, but it's, I see this would have been called my shorts weather in Massachusetts, but no longer. I have definitely outgrown my tolerance for the cold. But I trust that all of you, as good public health stewards, are doing a good job of promoting good, positive health behaviors as you seek your entertainment here in New Orleans. Dr. Mean and Dr. Prashker, thank you so much for your visit the other day. That was very special and a lot of fun, and definitely reinforcing some of my interest in going back for that, maybe not to the MBA, but something very similar of pursuing that. So I look forward to hoping you'll have more offerings at Boston University that I can crash a few courses. So I was definitely very surprised and very grateful for this opportunity, mostly grateful because it gives me the opportunity to give some few public thanks to people, including Boston University. Definitely felt very well prepared there to be able to take advantage of a lot of different opportunities that I feel like have just continued to surprise me and sort of fall from the sky. And it was a really great opportunity there, and I in particular thank Dan Merrigan for a very embarrassing experience in a class of having to do public speaking in front of a video camera where I completely froze. But where that also helped me to remember is what actually taught me sort of in the long haul was one, prepare myself a little better, but then also to make sure that what I do has meaning to me personally in what we do. And I think also, so I feel very fortunate every day that I've been prepared to be able to do meaningful and engaging and challenging work, and which has then recently been confirmed through Kelly McGonigal's TED Talk on how to make stress your friend, which is you have to chase meaning. I also would like to say thank you very much to Cynthia Swear and Michelle Leto, who are here, two of my fantastic teammates. I work with amazing people every day. I'm very grateful for that. And you all really exemplify our examples of our values of critical thinking and for critical thinking and being change agents. Though I'm realizing we really did, when we merged our programs, the family planning and maternal and child health, we forgot one value at least, which is humor, because I swear I don't think it's legal to laugh as much and as hard as I do at work with these great, fantastic people. And then lastly, I would like to say thank you to my husband, Socrates, who 20 years ago when we met, he said very shortly after getting to know one another, he said, you're not going to the Peace Corps, even though I'd already signed up for everything. And he said, and when are you going back to school before we have kids? And I was like, we just met each other. So he was very kind and helped me. He went to the library with me all the time to help me photocopy articles. I don't know if some of you remember that, but you had the new internet. It was awesome because you could use the internet to find the articles instead of having to go to the card catalog, and then you could photocopy them. It was great. But you also taught me two very important lessons, which is if you want something or you believe in something, is to go get it, and no matter how many obstacles you have in your path. And the other thing is to play very hard and to work and play as hard as you work. And so I wanted to say in front of all these people that our daughter Izzy has decided that one horse that we just adopted, one racehorse, is not enough, and she doesn't want to share it, so we're going to get two. Is that okay? So thank you very much. I very much appreciate the opportunity. Thank you.
Thank you, Amy. Amy just reminded me that I found something in the French Quarter that I'm taking home. It's a little plaque, and it says, "Work like a captain and party like a pirate," which I thought pretty much summed it up. So, here we are in New Orleans, maybe 2,000 miles away from Boston, and what could be more appropriate than to recognize a distinguished alum from our own backyard? So I'd ask Rodney Vanderwarker to come up. Rodney? So Rodney's a new graduate, only 08. I mean, that's just like yesterday. But Rodney works for what is one of the most remarkable and effective organizations in the entire city of Boston, and that's Fenway Health Center. So Rodney's role at Fenway is to oversee administration and operations for the behavioral health and medical departments at Fenway Health, and those are the organization's largest departments. He also manages the partnership between the Ajax-Jackson Committee and Fenway Health, and if those of you are familiar with the history, know that partnership was absolutely critical to addressing the HIV/AIDS issue in Boston. So he's been at Fenway Health for over 15 years, first serving as a research coordinator on an HIV prevention study. So he's held his positions of administrative director and manager of research operations, and while doing that, he oversaw community education, research studies in HIV/AIDS and in LGBT health. Prior to joining Fenway, he directed an AIDS service organization in New Hampshire. He was a peer educator and volunteer coordinator at other New England health organizations, and he currently serves on the SPH Health Policy and Management Department's advisory board. In addition to his MPH from BU, he has a Bachelor of Arts in History from Lemoyne College. So Rodney, we're pleased to recognize you as one of our Distinguished Alum Awards for your work, and to be quite frank, for the work of the wonderful organization that you've been at. Please.
Thank you, Dean Manin. And you will all be pleased to hear that our party apparently is much better than the Harvard party that's happening. So thank you for those of you who snuck out to be here with us. So I'm really honored to receive this award and share this moment with all of you. And first, I want to thank Fenway Health, who's been my employer for over the past 18 years, and our president and CEO, Steve Boswell, who joined us here tonight. It's been such an honor to be part of an organization that has successfully advocated for the inclusion of lesbian, gay, bisexual, and transgender health in our nation's conversations about health equity, and to see that grow over the last several years. If you're not familiar with Fenway Health, we are located in Boston, where we provide high-quality primary care services to our neighbors and patients from throughout New England, both LGBT and not, and we've been around since 1971. So in addition to providing great care, Fenway has taught thousands of healthcare providers, leaders, educators, and policymakers the knowledge and skills to care for LGBT people. Even in very remote parts of the country and the globe, we're helping to make sure that everyone gets the high-quality care they need and deserve, regardless of their sexual orientation or their gender identity. Fenway Health has also participated in the discovery of new treatments to ensure that people living with HIV can enjoy long, healthy lives. And we've learned that those same treatments can actually help prevent HIV infection. AIDS Action Committee of Massachusetts has recently merged with us so that Fenway Health now has a much broader capacity to serve people with HIV and to provide prevention services. So with new technologies and with Fenway's increased capacity, for the first time in my long history of involvement with HIV services, I'm truly convinced that we can eliminate new HIV infections in Massachusetts. So I'm really excited about that. So it's been a really exciting and challenging to be part of the work, and I owe a huge thanks to Dr. Boswell, to Dr. Ken Mayer, who's Fenway's medical research director and founder of the Fenway Institute, and the other leaders of Fenway Health who offered me an opportunity to be part of such a wonderful organization so many years ago. So I also feel like I need to thank, of course, Boston University for providing me with the education and skills to assume a broader leadership role at Fenway Health. Like a lot of you, I was working full-time and taking classes part-time when I returned to BU starting in 2004. And as many of you can empathize, it was hardly a relaxing 3-year period. But I can assure you it was worth every minute, from the late-night group meetings to every weekend spending studying. The world-class education I received at BU helped fill knowledge gaps and gave me a completely different view of what I was learning through my work at Fenway Health. And I want to thank Professor Victoria Parker, who is Associate Chair of Health Policy and Management, who was and still is a mentor to me. Without her support and understanding of my status as a returning student, I would have never made it through the program. I'm also really indebted to the Health Scholars Program at BU, which offered a great deal of assistance with tuition. So we should all try and support that program as much as we can. So I've always been impressed with BU's commitment to our community and to the social justice issues, and it's best demonstrated through the work of its faculty, staff, students, and alumni. So whether it's lesbian, gay, bisexual, and transgender health, HIV prevention and treatment, or other critical public health issues, I know that all of us who are part of BU are making the world a better place each and every day. So thank you for that.
Thank you, Rodney. Well, as has been mentioned, I'm stepping down at the end of December, and there's a nice numerological element to that. I will have been dean for 22 years and 2 months. It's been a great ride. It's been a wonderful experience working with the faculty and the staff, watching the school grow, and most importantly, as you listen to our award winners tonight, knowing about the impact that our graduates have had and will continue to have has really been wonderful. So at this point, if some of you may have seen the magazine, the Sphere magazine for the School of Public Health, and the title for this edition is Next Things, essentially the next big thing. So I'm very pleased to introduce the next big thing at Boston University School of Public Health, Dr. Sandro Galea. Sandro, come on up. So Sandro is currently the Gelman Professor of Epidemiology and Chair of the Department at Columbia Mailman School of Public Health, and he will become the next Dean of the School of Public Health on January 1st. He has a remarkably distinguished resume. He has been the president of the Society for Epidemiology Research. He is an elected member of the Institute of Medicine. He has published more than 450, that's the correct number, 450 scientific articles, books, and publications. He's trained as a primary care physician originally, and then returned to get his master's degree and his at Harvard and a DRPH at Columbia. So I couldn't be happier to turn the stage and the school over to the next Dean of the School of Public Health at Boston University, Sandro Galea. Sandro?
Thank you very much, Bob. Now, I know that what you're all wondering is why the new dean came up here with a drink. It's going to be a fun ride. I will get to the drink in a second. It's really very exciting to be here. I want to start with just a moment of reflection. I know it's a party, and it seems to me always somebody's job to sort of bring us back to our day jobs. But I just want to give you a few sentences about why I'm in public health. As Bob mentioned, I'm trained as a family physician, and I often tell the story that I decided to go into public health when I was working with Doctors Without Borders in Somalia. I was in Somalia, in Mudug region, northwest Somalia, soon after the government of Said Barre fell, and I was doing more good clinically than I think I ever could anywhere else. And it was then that I realized that I was interested in this idea of public health, which frankly I knew nothing about because doctors really are not trained that way. And that's when I applied to public health school, and here I am. So I just want to give us a few facts to wrap our brain around. So a baby born in Tanzania today has 10 times greater chance of dying before she hits 5 than a baby born here in the US. An African-American woman born in Mississippi will die 7 years before a white woman born in Massachusetts. At the same time, the risk of death from injuries in this country has dropped 5-fold in the past 50 years. We have gained 20 years in life expectancy globally over just 50 years, which is really astonishing. For example, in Chile, a child born today can expect to live to age 79. In 1950, she could expect to live to age 55. And we know about quite a bit of public health that works. We know that in the United States, if we were able to implement primary prevention consistent with the state of the science, we could save 91,000 more premature heart disease deaths, 85,000 cancer deaths, 29,000 chronic lower respiratory disease deaths, 17,000 stroke deaths, and 37,000 unintentional injury deaths. All of that we can do if we follow public health science. Now, there are many definitions of public health, and the National Academy of Sciences has my favorite definition, which is public health is what we as a society do collectively to assure conditions for people to be healthy. What I like about that is that it makes it very clear that public health is a team sport. It is not what I do, it's not what you do, it's what we all do together. And at the end of the day, it's about the conditions for people to be healthy. And it's really fantastic to be here following the Distinguished Alumni Award winners, because they are really all working on creating the conditions for people to be healthy, from effective functioning health systems to health departments in states which are providing the best possible primary public health, to international organizations at the forefront of tuberculosis control. There is no question that we face real challenges. Anybody who's been reading the newspaper knows that threats like Ebola continue to really threaten the health of the public and pose challenges, but we also face real opportunities. So I'm excited to take this position, and I was really excited when I was offered this position because I think schools of public health have a really extraordinary opportunity. It's the job of a school of public health to produce the knowledge that can guide us for figuring out how we can be healthier, to educate our students about that knowledge, and to produce the workforce that in 2030 is going to be emerging as the leaders and the managers of public health. If everybody thinks about our graduating students, they will, in 2030, not so long from now, 15 years from now, be in their early to mid-40s, which is when they will be leading public health, so that it is accessible, relevant, and useful. I think increasingly, academic schools of public health have a critical role in delivering to multiple constituencies our science, that it is our job to not just be a part of, but to shape the public health conversation. Because frankly, if we do not do it, who else is going to? So these are the responsibilities that I think I take seriously. I think this is what the school should do. It's what we as a school can excel at and how we can become leaders in the field. And I think we can do so, not just because it means we are doing well and can be proud of our work, but also it means that we will be doing good by doing so. So I take on this job with a lot of excitement and a fair bit of fear, which I think is probably healthy. But I am really very much aware that I would not be here today with the confidence that we're going to do great things together if it wasn't for the fact that I know we are building on the outstanding legacy of Dean Menion. So in Mickey's introduction of Bob, where is he? Oh, he's in the back. All I see is the mic. Bob, come on forward a little bit. Yeah. It's on. I didn't think you were shy. So let me say just a few other things about Bob, which haven't been said yet. So it's been said that he has led the school through a remarkable period of growth and positioned the school for excellence. I think it's a remarkable, remarkable legacy that he has left the school. And we will celebrate Bob a lot, and we'll embarrass him in the future. But I just wanted to comment a couple of other things. Mickey said in her introduction that Bob is the longest-serving dean at BU. What I don't think she said is that actually he is the longest-serving dean of a school of public health anywhere in the world. Bob is essentially the dean of deans. I was recently in Atlanta and visiting with the dean of the Emory School of Public Health, Jim Curran. Jim, who's a lovely man, was actually gleeful that Bob was stepping down. He said, "Now I can be the dean of deans." But Jim's done this for 19 years. I'm like, he's like a punter by comparison. It is, as someone who is looking at this job, it is astonishing to think of anybody being able to do this for 22 years and have the kind of impact that Bob has had. When you look at when you just look at the numbers on the school and where the school was and where it has come to, it is simply extraordinary. It is a legacy that I think all of us can only wish that we can have in our own lives. And I think all of us here are benefiting from this remarkable legacy that Bob is leaving us. So now I come to why I walked up here with a drink. So I would like to raise a toast to Dean Mina. And I would like to toast to a tremendously successful run leading this great School of Public Health. And we all aspire to do you proud. Bob, thank you. Cheers. I am very much looking forward to working with all of you, looking forward to continuing to work with Dean Meenan, leaning on the advice of Dean Prashker, and to meeting all of you over the course of many months and years, maybe to remember everybody's name. And, but really, I think this is a remarkable place, and it is a place that is poised to shape the public health conversation in years to come. Thank you all for being here. I am told that I am now to close the official part of the party and to say, may the party resume. Thank you, everybody.